Hi everyone, so in today's video we're going to talk to you about how we can appreciate joint segmental behaviour to understand the nature of someone's movement behaviour. Okay, so whether the task is based on producing high levels of force in a particular direction, or whether the goal of the task is to distribute forces over broader surface areas, to manage forces, to absorb forces if you like. So they're two very different strategies. And what you're going to see here in the video in screen is you're going to see a boxer throw a punch. And what I want you to appreciate is that that's taking place very much in a proximal to distal pattern of workload distribution. So we're seeing that movement from proximal to distal to concentrate that force in one direction. But even on a deeper level, if we look at the joint segments, what we're seeing is that internal rotation of the scapula, coupled with that internal rotation of the humerus, coupled further distally with that internal rotation of the forearm. And that movement of those joint segments in the same direction, in internal rotation, allows for the athlete here to produce force, very high levels of force, in one direction. Okay, so the goal of the task, the goal of that movement is to produce force, not necessarily to distribute forces. Okay, because what we're lacking there, so what we're lacking with that motion, we're seeing that internal rotation of the scapula, where the scapula comes around and the glenoid cavity faces more forward, coupled with the internal rotation of the humerus, coupled with the internal rotation of the forearm, or pronation of the forearm. What that lacks is opposing rotations between those joint segments. And what opposing rotations between joint segments offers the system is a broader solution space. And a broader solution space offers the system more options to distribute forces and redirect forces. But that's not the goal of this boxer. The goal of this boxer is to produce high levels of force in one direction. Okay, now we can further look at this across other tasks, more low intensity tasks, where the focus is not necessarily to produce high levels of force, but to move the limbs in different directions and manage forces at the same time. But again, what we need to appreciate is that the movement of joints in a particular direction and how they may lack opposing rotations, or they may not lack opposing rotations. It's all task specific, so it's not a bad thing. It's also not necessarily a good thing. It has to be viewed within the context of the task and the goal of the task. And so if we compare that segmental behaviour and the strategy underpinning the goal of the individual to this video here, we can see that we may not want to express that segmental behaviour in the same direction just to pronate the hand to grasp an object. We need to have the capacity to dissociate between joint segments. So in order for me to pronate my hand to grasp an object, if I had to internally rotate the humerus and internally rotate the scapula to achieve that pronation distally every single time, then that represents that I have a lack of solution space there. That represents a lack of dissociation. So what we need to do is understand that there's a potential mismatch in the strategy used here to complete the task, or to manage the forces from the task. So it's a low intensity task relative to the high intensity task of producing high levels of force in a particular direction. So for an athlete, we wouldn't say it's necessarily a bad thing, but we would look at its appropriateness based on the task within the context of the task. So if I have to allow for that segmental rotation in the same direction every time to produce an internal rotation distally to grasp an object, then that may reflect a lack of solution space. That may reflect a lack of movement options to manage forces, and so that may dictate or influence the kind of strategies that we use to rehabilitate the client if they're experiencing pain or if they're experiencing movement limitations. So looking at the segmental behaviour offers us an insight into the potential strategies that the client is using, or the potential range of movement options that they're expressing. Okay, so it's really important to look at segmental behaviours, not just muscles. If we look at muscles, muscles are very redundant, muscles are very complex. But if we look at the directional behaviour of joint segments, oftentimes they can offer us a much broader insight, a much more well-rounded insight into the coordinated capacity of the client, and that can have a much greater impact on how we assess them and how we carry out the treatment plan.